entitled Evidence-Based Practices, Leveraging Best Practices for School Improvement. My name is LaShondra Scroggins, and I'm the Director of Teaching and Learning at ALSE. During this presentation, you have the opportunity to type questions into the chat box in which we will answer towards the end of the session. Thank you again for joining this session. The objectives of this webinar is to define evidence-based practices. From here on out, I will generally refer to them as EBPs. Give a brief overview of EBPs in terms of the Every Student Succeeds Act, or ESSA. Look at how to identify EBPs to improve your current practice. Identify resources to consider when identifying EBPs that are aligned with your school's needs, and look at effective implementation and evaluation of EBPs. In this section, we're going to look at how evidence-based practices are defined and different levels of scientific evidence. Within the new Education Act, ESSA, the term evidence-based practice is used over 50 times as a requirement. But what does it mean? Practices are defined in terms of three buckets: best practices, research-based practices, and evidence-based practices. Of the three, EBPs are the most rigorous and provides a high level of evidence that the strategy, curriculum, or intervention will do what it claims that it will do. This is because of the criteria needed to meet this level. So this slide shows the continuum of what is most likely to show the evidence that you desire to what would least likely show the evidence that you desire in terms of evidence-based practices. ESSA provides a definition of evidence-based practices. This definition states that in order to be identified as an EBP, it must demonstrate a rationale based on high-quality research findings or positive evaluation that such activity, strategy, or intervention is likely to improve student outcomes or other relevant outcomes, and includes ongoing efforts to examine the effects of such activity, strategy, or intervention. ESSA also outlines levels of EBPs based on soundness of research. The levels of EBPs designated include strong, moderate, and promising. This too is a continuum, but it is based on the type of study and the research design used in the study. In this section, we are going to focus on how to implement EBPs. This next question is quite substantive, so I will stop intermittently to see if there are any questions. To assist states, districts, schools, educators, and partners, the U.S. Department of Education released new guidance on EBPs in their resource titled Using Evidence to Strengthen Education Investments. In this non-regulatory guidance, a 5-part plan is presented that will help stakeholders leverage rigorous, relevant evidence to improve outcomes for students. The 5-part plan will be discussed in the subsequent slides. When thinking about utilizing the 5-part plan, we want you to think about a real-life situation in which you could utilize this guidance. For now, let's consider the case study presented here with DC Stars High School. This fictitious high school has looked at its data and determined that the graduation rate for students with disabilities is persistently low and has been for several years. There has been a new principal appointed charged with examining this challenge and producing outcomes. The principal wants to use EBPs to address the issue. Now we're going to examine part 1 of the plan, which focuses on identifying the needs of the school. When identifying school needs, both quantitative and qualitative data should be analyzed. The following are critical questions that the team should consider. What data are necessary to understand the school's needs or root cause of their needs? How do schools and LEA's outcomes compare to the goals established? And how should the needs identified be prioritized? In order to address the low graduation rate of students with disabilities, the principal forms a work group consisting of key staff such as the SPED coordinator, ELA and math specialist, data manager, attendance liaison, and guidance counselor. The team reviews data and determines that 60% of incoming students with disabilities will repeat 9th grade. There's an extremely low rate of 10th graders scoring 3 or better on the PARCC in ELA and math, and 30% of 9th graders who repeat end up dropping out before they enter the 11th grade. The attendance liaison and guidance counselor meet with some repeating 9th graders and their parents and learn these students had significant challenges transitioning from 8th to 9th grade and connecting with their new school. These students also express difficulty asking for and receiving help. Now we are going to look at selecting relevant evidence-based practices, part 2 of the 5-part plan. After teams have reviewed their data, they are charged with selecting interventions that are relevant to their needs and that are rigorous enough to help reach their goals. There are several questions that the team should ask as they are looking at the appropriate intervention to select. These are just some sample questions. Do the variables measured in the studies align closely to the context of your school? What is the setting? And what are the demographics of the participants in the studies? Once the intervention is selected, the team must determine if it meets the evidence-based criteria. Here are some critical questions to ask. What qualifies as evidence-based and how is that determined? What resources are available to help schools select EBPs? And were studies conducted in settings and with populations relevant to the context of our school and the needs that you're trying to address? As we previously shared, there are several levels of evidence. All levels require a statistically significant effect on improving student outcomes or other relevant outcomes. When selecting interventions, there are several types of online resources that can be beneficial in helping you to determine which one would be best for the needs of your school. These include clearinghouses, article databases, and resource collections. We will go into more detail in subsequent slides. But the clearinghouses provide reviews on research that has already been conducted and provide educators with information to help them to make a decision on an appropriate evidence-based practice. Article databases are digital libraries that actually houses research articles that have been conducted. And resource collections are similar to clearinghouses, and they often look at actual programs. On this side, you will find 4 examples of clearinghouses: What Works Clearinghouse, Regional Educational Laboratories, Results First Clearinghouse, and Campbell Collaboration. The great thing about clearinghouses is they have done some of the hard work for you. This entity reviews research that has already been done, and it's on a wide range of academic and behavioral studies. They review the studies to determine the soundness of the research and that the intervention, curriculum, and strategy does what it claims it says it does for specific populations. If you would like additional assistance with walking through the clearinghouses in general and/or in relation to your school data specifically, the teaching and learning team at ESSA would be more than happy to assist you. For those of you who want to search more specific articles, we have the article databases. Some databases you may want to consider are the JSTOR, Education Resources Information Center, also known as ERIC, and Google Scholar. Again, these article databases actually house the research articles that the clearinghouses compile in order to determine if the research is sound enough to be considered an evidence-based practice. Here are 3 examples of resource collections. They include Blueprints for Healthy Youth Development, the Best Evidence Encyclopedia, and Turnaround Practices and Evaluation Reports. For teams that want to complete independent research or want to locate interventions that have not passed through a rigorous analysis, such as a clearinghouse, you may find the link below from West Ed beneficial in helping to determine the quality of selected studies, resources, and interventions. Next, we're going to revisit our case study. So back to our case study with DC Stars High School. The team determines that in order to make the greatest impact on graduation rates with incoming 9th graders with disabilities, helping them connect to high school and making a successful transition, they want to select an EBP that is relevant in all identified areas. In their review of EBPs, they learn about Check and Connect, which is an evidence-based mentoring model focused on increasing student engagement in school and in learning to improve outcomes. The school team learns from their central office that this particular model is being offered by ESSA at no cost to the participating school. So the team decides to move forward with this EBP. And as an aside, Check and Connect has been offered by ESSA. I'm going to stop at this point to see if there are any questions. Okay, I'm going to move forward. Next, we will look at how to plan for implementation once you select your EBP. Once the EBP has been selected, the team needs to develop a comprehensive plan on how they will implement it. Here are some questions to consider. What are the specific goals, strategies, and accountability and progress monitoring metrics we will employ? Who will implement the intervention and when will it take place? What resources and supports are necessary for full implementation of our strategy? ESSA has a resource on its website focused on school improvement. You can find specific guidance by clicking on the link in the slide. And once the presentation is over, you will have the slide deck where you can click on each of the links. Now we're going to turn back to our case study to see how to plan for implementation in this current scenario. The team decided to use Check and Connect. Now they need to review data in order to identify the number of incoming ninth graders with disabilities and identifying the number of staff needed to serve as mentors based on the model's recommended caseload specifications. Selected mentors are briefed on the project. The principal and team identify data collection and how they will track effectiveness. The principal and team will review the school schedule to ensure activities related to Check and Connect can be accommodated. Finally, the principal appoints the AP to coordinate the implementation of the model, and the AP schedules training for the identified mentors. Part 4 of the 5-part plan focuses on implementing the selected EBP. When schools are ready to begin implementing the selected EBP, they should establish routines and have methods for collecting information to determine when course correction is needed. The team should consider the following questions. What is the most relevant information that can be collected to monitor the quality of implementation? Is the implementation plan being followed with fidelity? Why or why not? Are there any unforeseen barriers to successful implementation? Are there any additional resources that may be needed? You can find specific guidance by clicking on the link on this slide below. Let's take a look at how this looks with our case study. Once the team completes their summer Check and Connect training, the AP and team meet to plan how they will launch the model, including embedding an overview of it in communications and start of school activities with students and families participating in the model. The plan includes monthly check-ins with designated mentors, families, and students to identify what is working well with the student, what their challenges are, and what actions need to be taken to course correct. The monthly check-ins are also an opportunity for mentors to review attendance, behavior, and other relevant performance data with participating students. We have now come to the final part of the 5-part plan, examining and reflecting on the implementation of the EBP. In part 5 of the plan, the team takes time to reflect on the intervention's impact on relevant outcomes. Some questions to consider include, what are interim progress and performance milestones that can be tracked? Is there a need and capacity to evaluate the effectiveness of an intervention that could produce strong or moderate evidence? And based on the information gathered, should this intervention continue as is, be modified, or be discontinued? In addition to these reflective questions at the top, including how closely does the outcome data match with what the evidence predicts, and how the outcomes of interventions may be beneficial to your LEA or school network, strong leaders will take this time to plan and scale interventions that have been successful, determine when needed, if there needs to be modification of an intervention that is moderately successful in order to try to reach targeted outcomes. And when an intervention is unsuccessful, they will revisit part 2 of the 5-part plan, which is selecting relevant EBPs. We will go back to our case study one last time to see how DC Stars High School examined and reflected on the implementation of their selected EBP. The AP solicits feedback from staff members on what is working well in their first 3 monthly meetings. They will also note any operational challenges as early as possible. Course corrections will be made based on feedback. At this time, data collection is not occurring consistently because mentors are challenged with fitting it in their routine. In an effort to ensure the program is effective for all involved, the AP designates a front office staff member to be trained by the data manager so that they can assist mentors with data collection. The AP and principal meets with mentors after the first quarter to review the implementation of the model, examine impact using student data, and obtain feedback from participating students and families. Initial quantitative and qualitative data indicate that the model is having an impact on students. Based on these outcomes, the team decides to expand the model to include repeating 9th graders with and without disabilities. Now that we have gone through the 5-part plan, I will go over some important things to consider for effective implementation of your EBPs. The key to effective implementation is to collect data early from multiple sources early on to allow course correction. Make sure the team has created enough key touch points and tracking systems to measure how well you are implementing the EBP, not just the EBP itself. This is very important. To really find out whether or not the intervention is working, you need to ask the right questions and ask the right people, including students, and document lessons learned from the implementation process along the way, and to help inform program design and help share learnings throughout the organization. And finally, acknowledge efforts made by the team and students frequently and celebrate successes. They're hard to come by. For more information on ESSA and EBPs, please follow the links in this slide. The Every Student Succeeds Act gives more information about policy. The guidance that includes the 5-part plan using evidence-based practices to strengthen educational investments can be found in the link here, as well as the Department of Ed's guide on identifying and implementing educational practices supported by rigorous evidence. Thank you very much for joining the webinar this morning. If you would like additional support for your school, please email me at the email address on the screen provided, or the team at ossi.tta@dc.gov. If there are any questions, you may continue to type them in the question box. I would like to thank you again, and we look forward to working with you this school year.